My name is Teresa Simon, and I'm an epidemiologist and cannabis researcher. And today, on behalf of my co-authors, who are also either epidemiologists and/or cannabis researchers, I'll be presenting Can Cannabis-Derived Data Be Monitored in the FDA FAERS database? I'd like to thank the organizers for inviting me to discuss this important topic. These are our conflicts of interest. We don't have any. However, we do support the choice of individuals to use products from regulated markets. More on that later. So the takeaways from today, you'll learn that delta-8 tetrahydrocannabinol occurs naturally on the plant if you didn't know it. You'll learn about the FDA FAERS database, that there's an increased number of delta-8 THC poisonings and adverse events, that all cannabis products are not created equal, and how you can contribute by using our QR code. You can scan it now, or hopefully you'll scan it later. So this is my outline. We'll talk about some background, the objective, methods, results, our proposal, summary, and recommendations. And in the background, you'll actually see the chemical molecule of delta-9 and delta-8 THC. And the only difference is, you see that little 8 up there in the left-hand side next to the 9, is that's where the double bond is between 8 and 9 for delta-8, where delta-9 is between 9 and 10. So a little bit more on hemp versus cannabis-derived delta-8. It's a true-false kind of dichotomy, and hemp-derived delta-8 versus cannabis-derived delta-8. So delta-8 is present naturally on both the hemp and cannabis plants, however, in very small amounts. It's an isomer, meaning it's synthesized or artificially derived, especially from the hemp products. In the regulated cannabis, it has delta-8 listed on the label and certificates of analysis. It's only sold to qualified individuals. And currently, the extractions from the hemp plant are being synthesized to become a Schedule I drug, sometime in people's bathtubs, believe it or not. Now, some say that if we gave delta-8 versus delta-9 THC product to someone, you may not be able to tell the difference. However, I would argue that point based on some of the adverse events that we've seen. So here, again, some background on the plant composition. The only thing, cannabis and hemp have lots of ingredients, over 100 cannabinoids, and they all occur differently at different times of the plant. So you're not going to get everything all at the same time. But the point of this is to show that delta-9, you might not be able to see this, and delta-8 are both present on both hemp and cannabis. So 2 years ago, there was very little publicity on delta-8 THC. And the past year, actually March 2021, there started with the first case reports of delta-8 toxicity were in the news from the poison control centers around the United States. We're all aware cannabis is not approved at the federal level, and there's minimal safety data collected at the state level. But some products that are purchased refer the consumer to the jurisdiction's poison control centers if the customer or consumer experiences an unwanted or side effect. The question for me was, who's minding the store? So what I mean by this is it's hard to understand how a regulatory body that allows THC isomers to be sold without qualification or oversight, especially at unregulated storefronts where purchasing delta-8 THC seems easier than buying tobacco or alcohol. State licensed dispensaries who want to sell the same type of product have to follow laws and regulations and distribute the products, including prohibiting sales to minors, I'm going to emphasize that, minors, and following product labeling and accuracy standards. So, has the THC and delta-8 gone wild? I think so, because here, let me just show you these two pictures that are here are places that I've taken all the pictures in this presentation, and this is a health and wellness center, and they have delta-8 is sold here. It's here in New Jersey. And another town outside of just what is perceived to be a plain chocolate store, that I bought lots of chocolates there, regular, really high quality chocolate, has a sign out there, want to get high, try delta-8. So one weed company, based on Rolling Stone about a year ago, says it's skirting marijuana rules to sell THC products in all 50 states. So since March of last year, 18 states, and this changes every day, have either banned or restricted the selling of Delta-8 products. And I want to show you that some of these states, Delaware, for example, New York, for example, I have taken pictures of Delta-8 products in CBD stores in these states. So on September 14th, 2021, which just so happened to be my birthday, both the FDA and the CDC issued health advisories around Delta-8 THC and case reports of adverse events that had been reported to, and we'll talk about this, the different filings, which was the Poison Control Centers and in the FDA FAERS database. So one last thing before we really get into the data is based on that health alerts, I since had looked at the data in social media because from my perspective, I looked at all news avenues and there was no national coverage of something like that covered the Delta-8 poisonings. So when I did a social media mainstream search, and I actually submitted an abstract and I'm pending, hopefully, acceptance, some of the quotes are free weed that gets you high. And then these other pictures, the big billboard was driving down Interstate 95, big billboard about got Delta-8 THC. And, you know, it talks about that you don't need a medical marijuana card. The other pictures that are flashy and all different kinds of colors, products that I took pictures of in Delaware. And then the D8 gas, best Delta-8 THC product. Don't remember exactly where I could pick that one up from. But now the latest and the greatest is I was telling my mother, who's actually 83 years old, about my Delta-8 analysis. And she said to me, Delta-8, I think I know that. One of my friends here that lives in my building gave me this product. And so I said, oh, please take a picture of it for me. And so here it is, 1,000 milligrams of Delta-8 high potency. It's a roll-on product, and it's being passed around in the senior community. This among other Delta-8 products. I will tell you this is in Texas, and Texas is not one of the states that has banned it or restricted it yet. Okay, so moving on, one last thing that just happened a week ago is that online shopping for Delta-8 products is very big. However, Shopify has put a little bit of clamps down on it recently, and they said that you're not allowed, you cannot state that your product has any medicinal or therapeutic benefit unless the claim has been approved by the FDA. Also, I'd like to highlight this. The product contains no more than 0.3% THC. That's total THC, regardless of whether it's Delta-8, Delta-9, and Delta-10. Most products that you'll see, they'll say, oh, it's within the 0.3 THC, but it's only Delta-9. That's how they're skirting it. All right, so now down to the study and the analysis. So the objective of the study was to evaluate case report data on the nature and extent of cannabis-derived products, specifically Delta-8 THC products, in the FDA Adverse Event Reporting System, or the FAERS database. So just a little side note, as an epidemiologist and over 25 years of experience monitoring the safety of FDA-approved products, I'm very familiar with the FAERS database. And this is what I did immediately 1 year ago, was to look into this database. So it's a U.S. database. It was originally designed to support the FDA's post-marketing safety surveillance program for approved drugs and biologics. However, it's evolved to a much broader public health initiative where healthcare professionals and consumers can report adverse events or side effects on any medicine or product that's on the market. So we looked at reports for Delta-8 THC, I looked at Delta-9 THC, cannabidiol, and cannabis sativa. And the first search was performed, like I said, March 2021. The data presented here is up to December 31st, 2020. The the data that the FDA publishes is by quarters. I do have a little bit of updated data presented in this, but like I said, it's quarters. So the data is not really 2 years old, just to make sure that everyone knows that it's actually very current. One other comment is that the cannabidiol in the FDA FAERS database was all Epidiolex. And so then when you do an analysis like this, you need to understand who your best comparator is. And when you have something as novel as this, like a delta-8 THC compound that's synthetically derived, there's no real comparator. And so I used two goalposts. I used cannabidiol, CBD, which is actually what they're deriving it from, and cannabis sativa, and that's actually the flower, the true plant. The delta-9 is in there, but the delta-9 is usually based on a positive test. So how does the data get into the FDA FAERS database? So this is a form, it's called the Medwatch 3500 form. Anyone can download it off the internet, fill it out, and submit it to the FDA, but it requires work, right? So it's not just a simple way of getting the data in. You have to know about it, you have to download it, fill it out, and send it back in. Now, it looks like there's a lot of pieces of information that are collected on this form. However, in order to submit a form, you only need 4 pieces of information to make it a case. And that's the identification of the person having the event, the suspected product or products and the names of those, the actual reactions or adverse events, and the sender, the person who's reporting it. So healthcare provider, consumer, so they have different checkboxes. So now the methods, when you do something like this, these are count data, it's cases. We use something called a proportional reporting ratio, or a PRR. It's a disproportionality method, and it's used to identify statistical associations between products and events. It's a simple way to measure how common the adverse how common the adverse event is occurring. So the goal is to sort out whether the adverse event is occurring disproportionately higher compared to your comparator. It's very different from traditional epidemiologic studies or case analyses. This is the 2x2 table that you end up creating when you do this. And so a cutoff value of 2 is used as a benchmark to identify signals. I've seen some people use 3, however, traditionally it's 2. So now to the results. The overall results, this is the distribution of cases by reporting year. So what we have here is we go back pretty far, 1999 to 2010. In the background, I have the cannabidiol cases because once it was approved, there's an increase in cases that's expected. That's usually what happens when a drug gets approved. So in the foreground, we have the blue line is the cannabis sativa. There's 580 cases. The delta-8, 135 cases. I'd like to just point out you start to see an increase in the cases just around the approval of the hemp farm bill. And then the delta-9 cases. Okay, so this is the distribution by age. So most of them occur between 18 and 64 years of age, but I'd like to point out to you under the delta-8 column, there are 14 cases of underage exposure. So these are the proportional reporting rates for delta-8 versus cannabis sativa. And what you'll see is there's a 2, it's actually greater than a 2 for the respiratory thoracic body system, where these are all the body systems, or we call them system organ class, that the adverse event would fall into. So 2, anything greater than 2 indicates a potential signal. We also looked at delta-8 versus cannabidiol or CBD. Now remember, most of this is Epidiolex in there. And we see a reporting ratio of greater than 12 in the respiratory thoracic body system. We also see an increase in the vascular diseases and musculoskeletal. So when we look at the Delta 8 cases descriptively, most of them were between 21 and 35 years of age. 22 of the cases occurred in less than 21-year-olds. The sex was 48% male. Most were reported by a healthcare provider and occurred in the United States. 73% were deemed serious. The most common occurrence of the adverse event was the respiratory system, and there were 14 deaths. So let's look at the events. So the most frequently reported events on Delta 8 were dyspnea, followed by toxicity to various agents, and then drug interactions, and then respiratory disorder, cough. You'll see chest pain, drug abuse, nausea, pyrexia, vomiting, and so on. Now, the respiratory events, there's a whole host of those as well, and they're listed here, not meant for you to really look at them, but there's 79 of them, so greater than 50% of the adverse events reported were respiratory in nature. So now I'm going to show you, like I said earlier, I showed you data up to December 31st, 2020. And I've done subsequent queries where I've looked at the data that's been presented or published for March 31st, 2021, and then again in June 30th, 2021. And there's a small increase in cases over time. Some may say, well, as soon as the March cases started to from the poison control started to get some national news, we started to see an increase in cases. I'm not so sure because the health advisory never came out until September of 2021. But again, you'll see, and so you see here, there's these 14 cases in less than 17, and it shifts. There's subsequent data that may get submitted to the FDA, and then they just change the case. There are no duplicates in this to the best of my knowledge. We applied and looked for the duplications. And then there's 13 now. So when we look at the outcomes, the deaths still, there's, an increase in the number of deaths related to this, where it's a suspect drug. It doesn't say this is it only, although there are a number of cases where they just list Delta 8, where others, they have other products as well. Hospitalizations are in the, greater than 25% continually. Serious, which means a serious event means it caused a hospitalization, it was life-threatening. That type of an event is deemed serious. Non-serious is something that did not require any sort of major intervention, and it wasn't serious or life-threatening. And that's about in the 25% as well. And then respiratory events, like I had said, is about 50% of the cases all have respiratory events. And the most common is dyspnea, followed by seizure. So this is the timeline of our Delta 8 investigation. I'd just like to take a moment and go through this so you can see how I've been monitoring this. So 1 year ago, the first Delta 8 cases were in the news from poison control centers, and I looked at this, and this is the 135 cases that I presented today. After I did this, I submitted a Freedom of Information to the FDA asking for the details on all 135 cases. So what's interesting here is that when I submitted it, I got a phone call from the FDA, and they said that unfortunately they could only give me 10 cases at a time, and it would take them several weeks to process that. And over time, it might take somewhere around 9 months for me to get the case details on 135 cases. So I had a conversation with this person and said, I don't understand. When I worked in pharma, if we thought that there was a signal with a product that we have on the market, and we went and asked for the details of those cases, we would have those cases within 2 days usually. I mean, very short time frame. So it was interesting how I was not able to get a lot of the details, right away. So then at the same time, I presented very early data in August of last year. We requested an FDA listening session because someone at the FDA actually heard this presentation from me and made the suggestion that I contact the FDA. So we did. I contacted the FDA. They granted me an October 1st listening session, but 2 weeks before that listening session, the FDA and the CDC issued health warnings. And remember, I told you this is my birthday, so it was a great birthday present. I was very happy. But it did not receive the national news that I had hoped that it would get. So here we are. We also continue to present at different departments of health. Dr. Marcoux works with the health departments in Pennsylvania and Delaware, and so we presented the data there. There's been subsequent data extractions. I submitted a manuscript. It's on a little bit different analysis than what's published here, so slightly different. But we launched something called the Buds Info Adverse Event Tool, and that was the QR code early on. And here I am 1 year later speaking to you about the Delta-8 poisonings. So the theory is that in 2018, the hemp farm bill was put into place. There was an overproduction of CBD, prices fell, and so now derivatives were made. And we don't believe that, for me, the Delta-8 itself may actually have therapeutic properties, but we don't know if it's the adulterants or the byproducts that are actually causing these adverse events. So in many ways, it's giving it a bad name, but we'll never know because we'll never have the opportunity to study it. And I think for me, that's probably a major takeaway, that it's unfortunate that a group decided to push out something that may not be so great for consumption. Okay, so the strengths and limitations. The FAERS data source is limited and underreported. We know that across the board. It doesn't, even for products that are marketed. It's the only known national database that I know that collects data on safety for any product, specifically cannabis derived products. Events are reported. There's overall exposures unknown, so you have no idea. It's really a case analysis. And signal detection tools do not imply causation. So I'm not saying that Delta-8 caused these adverse events. I'm just saying that there's a potential signal that one should be aware of when using certain Delta-8 products, especially if it's in the unregulated market. The strength is it's an early signal detection tool, and an analysis of proportional reporting ratios have been used as a measure of association in the past. So in summary, there's an increase in Delta-8 THC cases. Mostly young males in the United States have had severe reactions. These events disproportionately occur in respiratory events compared to cannabidiol and cannabis sativa. The FAERS may be the only source for national level data right now on cannabis-derived products. So we have some recommendations. So clarification of existing regulations would be really important, because it seems that many people are using the 0.3 THC just as Delta-9 and not total. Informing consumers on the ability to report adverse effects using the Medwatch Form 3500, anyone watching this. And that could be not just cannabis, it could be anything that you give a patient, or if you use yourself, you can self-report something. Education on products, especially label comprehension, is very important. Have a look at that certificate of analysis. People think that they're buying CBD when actually there's Delta-8 in the CBD and they're having an unwanted effect. Patient and consumer perspectives are important. I've done some work around this area where it's not just listing the adverse event, but how debilitating was that adverse event. It's important to really understand their perspective. A potential to create a sentinel-like system. We've spoken to the FDA about this. A national safety reporting mechanism for consumers is needed. So we have actually launched something. It's called, you can find it at budsinfo.com. It's our beginnings of trying to collect cannabis-derived adverse event data. So it doesn't matter whether it's hemp or CBD or cannabis. It doesn't matter. And we are seeking partnerships and collaborations. So this is the website, by Buds for Buds. And this is the QR code is coming up next. So scan it now. keep it in your back pocket if you ever have a patient who may have had an unwanted experience, or the patient or consumer can complete it themselves. I'd like to thank John Simon, who's a co-author, and Matthew Webwire, both MPH students at Drexel, for helping me create the form and getting the QR code launched. So it was great to have them on board with this project. So thank you. You can contact me or Dr. Marcoux, or actually John, me, or Andres at PRC Trials, and Jehan Marcoux at Marcoux Enterprises. So thank you.